let me give you some texture, if I may. Recently, a meeting between several Democratic senators and White House political advisor David Axelrod took place. Their goal, according to Senator Dick Durbin from Illinois, was to coordinate our messaging so we present a healthcare reform effort that American people trust. Now, the meeting was in part a response to advice circulated among Republicans by Dr. Frank Luntz, who you may have heard of. Dr. Luntz is a prominent GOP pollster, highly regarded expert on political messaging, author of a book called Words That Work. It's not what you say, it's what people hear. And in the memo, he urged Republicans to be on the side of reform while attacking the administration's proposals as leading the government, setting standards of care instead of doctors, and the government's rationing of care. Now, the Democrats in Congress wanted to make sure they were prepared to withstand the suggested assault that was coming. The recent meeting with senators and House leaders were designed to do just that. It was reinforced by a message that the president sent to the grassroots, which now operates as an organization called Organizing for America, which some of you may have heard of. During the campaign, President Obama accumulated millions of email addresses and personal contact information for folks to communicate with on a regular basis and be able to gin up support around specific legislative agendas. What was agreed upon was a three-pronged message. Medical costs must be lowered, people must have choice in their health care coverage, and the care must be affordable to everyone. How these principles are put into action is yet to be determined. No legislation has yet emerged from the numerous congressional hearings underway. It's the lack of explicit information that makes framing the reform effort so important. Until there's actual legislation to read, all the public has to go on is the general policy positions pronounced by various parties. Eventually we'll see a bill. I'm expecting that in the next 60 days, and I'll talk about that a little more in a moment. But how the public reacts to it will be influenced by some degree by the spinning that occurred before it's released. Now, by involving the Democrats in Congress early in the process of developing the legislative language and working with them to shape a unified message, the Obama administration is sidestepping one of the most damaging missteps of the Clinton administration. Ultimately, what will matter is the legislation itself, and it's certainly important to take that away from today. But the mere fact that President Obama and his team are avoiding the mistakes made 16 years ago is an indication of how different the battle will be this time. Now that we've looked back a bit and put 1993 into political context, what I'd like to do is present a few slides that show just how things might shake out legislatively, as well as discuss PhRMA's policies, my organization's policies, and the role that we might play in framing that debate. Feel free to ask questions anywhere along the way. Everybody's here, Ken?
Can you speak up a little bit louder?
Yes, ma'am. I'm sorry. You can yell at me, that's all right. I'm going to talk louder. Okay. Leroy has agreed to man the slide deck for me. It's an open discussion, so feel free to ask questions. Next slide. First issue I'd like to talk about is, as I mentioned in my remarks, certainly Congress is the one that ultimately will move this legislation and enact it. But the president plays a key role along with the administration. I'd like to talk about their beliefs, the players that will shape this debate from the administration's point of view first. A little background first. 2008 presidential election, 6 in 10 voters surveyed said that healthcare is a major issue or one of the major issues influencing their voting decision. And then leading up to the election, about 58% of the voters surveyed indicated Obama will do a better job handling healthcare than Senator McCain. Certainly up for debate. President Obama won the election by considerable margin, I guess it's fair to say, earning the political capital to move these reforms. In a recent poll in April, the majority of Americans, 59%, say economic challenge is making it more important than ever to take on healthcare reform now. I think the key finding from that is that a lot of policymakers, and thus down to the rank and file constituencies, have linked healthcare reform to the economic recovery. They feel it's part of what's going to make our economy bounce back a little stronger. His agenda, I mentioned, three-pronged messaging, which is very smart. It's simple. It makes the folks able to stay on message easy. Quality, affordable, and affordable health care coverage for all, modernizing the U.S. healthcare system to lower costs, improve quality, and promoting prevention and strengthening public health. Next slide. As I mentioned, the economy tying it to healthcare reform was a very savvy political move. His quote about healthcare reform is no longer just a moral imperative, it is a physical imperative. Before he slipped there. If we want to create jobs and rebuild our economy, then we must address the crushing cost of healthcare this year in this administration. Now, that's a bold challenge to the American people and to Congress. Getting this legislation passed, drafted and passed before the end of the year is a gargantuan task. Those of you that were involved in the 1993 healthcare fight remember how long that battle went on for. Some of the health reform goals were wrapped into the stimulus package that was already passed. Health information technology, comparative effectiveness research, which I'll talk a little bit more about in a few slides down the road. Veterans Health Administration, the VA, Medicaid funding for the states, and federal COVID subsidies. Little warning here that according to a new report, the Medicare Trust Fund will be exhausted by 2017. We need to find some savings. Now, some of the top players in the administration in healthcare reform currently, former Kansas Governor Kathleen Sebelius, she's the newly confirmed HHS Secretary. I don't know if anyone followed the soap opera that went on here in town about finding the eventual nominee. Former Senator Tom Daschle withdrew his name after much press around his tax challenges. Anyway, governor from Kansas, strong relationship with Obama. She's historically been able to work across party lines, which is certainly important in a cabinet secretary. She's said some positive things on competition and innovation, but certainly make her a little less threatening to the right of center folks in the business communities. Next is Nancy Ann DePerle. Obama's named a lot of czars in his administration. If you've noticed, sort of a new position. They don't have direct response to Congress, so they're able to navigate a little more under the radar. But Nancy Ann will play a key role in developing the healthcare reform policy. She's a veteran of the Clinton healthcare wars in 1993, and she has strong relationships in both the administration and Congress. So two key players. Next slide, Leroy. Let's talk about Congress, our favorite body. A little more background here. The 2008 elections were certainly historic. Depending upon your political leaning, that could be a good thing or a bad thing. But the Democrats gained 21 seats in the House in November, which is certainly a large number of gains. 257 Democrats, 178 Republicans. If you think about the numbers 4 years ago, 6 years ago, it was almost slipped a lot more Republicans than Democrats. Things have changed. And then the Senate, which is where the battle will take place, we have 59 Democrats with our recent switch of Senator Arlen Specter from Pennsylvania, and 40 Republicans, and we have one from Minnesota, which I don't know if that'll ever be decided. So don't hold your breath on that one, but certainly a sizable margin for the Democrats, assuming that one vote goes to the Democrats, which I think it will. Don't hold me to that. That gives them 60 votes, and those of you that know legislative rules and whatnot, 60 votes in the Senate is a filibuster-proof majority. It essentially says the Democrats can move almost anything they want if they hold their votes. So solid majority in both chambers. Senator Harry Reid from Nevada is the current majority leader. Nancy Pelosi, if she doesn't do any more press conferences anytime soon, will be the speaker. And Steny Hoyer from Maryland is the majority leader in the House. Just a quote in there from Pelosi. Certainly, they're geared and ready to move healthcare reform legislation. Next slide, Leroy.